feeling constantly exhausted, increased irritability, or feeling low without a clear reason, or there is a difficulty building muscles, an increase in belly fat, or a noticeable drop in sexual desire. This may be due to hypogonadism. Hello, I am Dr. Sandeep Harkar, urologist and andrologist. Let's discuss this topic today that many men in India feel shy talking about. The topic of male hypogonadism. In men, the testicles have two important functions: producing sperms for fertility and, more importantly, producing the main hormone, testosterone. Hypogonadism is a condition where the testes do not produce enough testosterone. Testosterone is responsible for everything from your muscle strength to bone density to your mood and sex drive. When these levels drop significantly, it affects your quality of life. So why does this happen? Testes may not produce testosterone for two reasons. One is primary hypogonadism, when the problem is within the testicles themselves. This could be due to an injury or an infection like mumps during childhood or certain genetic conditions. Another is secondary hypogonadism. This is more common today. The testes are fine, but brain itself is not sending the start signal. It may be because of organic abnormality inside the brain, but more commonly, it is linked to lifestyle factors we see daily. Extreme obesity, poorly managed diabetes, or even high levels of stress. So how do we recognize it? It's not just about manliness. It's about how you feel every day. Common symptoms include low energy, feeling constantly exhausted even after having a full night's sleep, mood changes, increased irritability, or feeling low without a clear reason. So what are the physical changes? Building muscles becomes difficult. There's increase in belly fat, or there may be prominent breasts in men, which is called as gynecomastia. There may be a noticeable drop in the sexual drive or difficulty maintaining an erection. If you recognize these symptoms, please don't turn to quick fix powders or unverified supplements often advertised on the streets. Please see an expert. You may visit a urologist or an endocrinologist. We will first assess, physically examine and confirm the diagnosis by a few tests if required. Coming to treatment, lifestyle modifications. In India, we are seeing a rise in lifestyle-induced low testosterone. Improving your diet, losing weight, and getting better sleep can naturally help boost your levels. But if needed, testosterone replacement therapy may be tried. It comes in various forms like injections, gels, tablets, or patches. And most men respond to it very well. But it must be taken under the supervision of a specialist. So the bottom line is that hypogonadism is a medical condition, not a personal failure, and addressing it early under proper supervision of a specialist can protect your heart, your bones, and your mental health. Stay informed and stay healthy.